Hi again, everybody. Healthcare workers looking to county leaders for support are starting to get some traction. This week, the county moved forward with plans to address the mental health struggles providers have faced and continue to face during this pandemic. Tahalil Mahadin joins us now with more.
Brad, this all began back in January when healthcare workers first spoke about those struggles with the Health and Human Needs Committee. They shared this data from a survey conducted on behalf of Wisconsin's largest healthcare union. They found that 85% of the county's healthcare workers say it feels like they're working in a war zone. 45% say they face threats and intimidation from patients and their families. And 19% say they know a healthcare worker who's considered suicide. Now, the scale and scope of these numbers are what county leaders are calling a wake-up call.
It takes a special kind of person to do this kind of work, and they are deserving of much more than just our thanks.
Healthcare workers in Dane County getting the attention of area policymakers.
I committed to them that they could count on me to try to work on some solutions for them.
A newly formed county-led subcommittee.
This is so urgent and critical.
Dedicated to figuring out a solution to the struggles that have been plaguing staff in the industry.
Without proper staffing and proper training, that we are not able to provide the services that we often sometimes guarantee them.
Made up of both medical providers and county leaders.
Politicians aren't always the best at brainstorming, so we need to rely on the folks who really know this issue well to come prepared with some good ideas.
Looking into funding programming that would address recruitment and retention issues, and even the trauma felt by healthcare workers through the pandemic.
It seems to me that the folks who have been doing the work, holding people's hands at their bedside as they're struggling through the pandemic, whether that be with COVID or something else, that's an investment worthy of those dollars.
Hoping to get providers back in top form so they can keep doing what they do best. Helping others.
I think of everyone as pretty much family, and how I would want someone to treat my mother or father if, the shoe was on the other foot.
County leaders say they will look into using funds from the American Rescue Plans, as they did addressing hunger, housing insecurity, and supporting local businesses to help healthcare workers. But they also say that alone will not be enough, hoping to build partnerships with all levels of government and private groups.